Hi everyone, this is going to be a teaching style video of our muscle attachments on the ilium. So the red boxes will be origin and the blue boxes will be insertion. But for the sake of this video, we are just going to focus on some of our lower extremity origins. So to start off, on our anterior superior iliac spine, we have our sartorius origination, and this is a pretty long muscle, and it goes all the way down to our medial tibia, which is known as our pes anserine region. If we come slightly inferior, we have our anterior inferior iliac spine, and the muscle that originates there is rectus femoris, one of our quadricep muscles. And that will run all the way down to the common insertion point for our quads, which will be the tibial tuberosity. So if we come slightly more medial, we will see this region right here, our iliac fossa, and the muscle that will originate there is our iliacus. And the iliacus will run down to our lesser trochanter for its insertion. And just to make note, we have another muscle called our psoas major, which would be running right around here on our vertebral bodies, T12 to L5. And it will be running down with iliacus to the common insertion point, the lesser trochanter. And when they run together for their insertion point, they're commonly known as iliopsoas. If we come more lateral and anterior, we will have this origin point for our tensor fascia lata, and visible body only shows our muscle body here, but so we can't really see like where it will end up inserting. But this muscle has a thick fascial band that runs down, and it ends up going to our lateral tibia onto something known as our Gerdy's tubercle. So that would be the insertion, but right here shows the origin for tensor fascia lata on the anterior lateral iliac crest. If we come more posterior, we will have our gluteal muscles. First, we have our gluteus maximus running on our posterior gluteal line. And then it's going to come around and insert down onto the gluteal tuberosity of our femur. Then we have our gluteus medius running on our anterior gluteal line or our middle gluteal line, and that will end up inserting on the greater trochanter of the femur. And then if we come slightly inferior, we have our gluteus minimus, which will be running with gluteus medius to the greater trochanter of the femur, which would be right here. So that shows how they end up running down to a common insertion site. So that's all of our origins for the lower extremity on our ilium.